Hello, my name is Jamie Scola, and I am a student dental hygienist over at Plaza College, and this is my OHI video. I hope you enjoy. Hello there, how are you doing, Mr. Sapone?
Good, how you doing?
I'm great. Before we start your dental cleaning, I'm just going to have you remove your mask.
Okay.
Just going to take a look inside your mouth,
Sure.
and you're going to look on with me. All right, open big. Awesome, bite down. Okay, you have beautiful teeth. They look very healthy and clean. I do see some crowding and a little bit of plaque buildup on the anterior teeth. Open big. And as well as behind the teeth, we will go over how to fix that. Awesome. Overall health looks pretty good to me.
Okay.
So now we're going to talk home health care. What are you doing at home with dental hygiene care at home?
I just brush my teeth twice a day. I do floss, but that's like once a week at most. That's about it.
All right, awesome. Sounds good to me. Do you tend to like brush your tongue at all? Do you?
Occasionally, not every time, but occasionally I do.
Okay, awesome. So my focus is for you to really floss these teeth right here, the anterior teeth, the lowers. They're a little bit crowded, which is a little bit harder to brush.
Okay.
And floss as well, but we'll take care of that. Show me how you brush your teeth at home.
Sure. So if I was to brush my teeth right now, I would be just side to side.
Okay.
And then
Awesome. You're doing your occlusal brushing. Love that.
that's about it.
Okay. Now I'm gonna ask you to floss for me, please.
Of course. So if I was just to floss, I would. And
Okay.
just lifting up when I do it.
Okay. And one more thing. Just show me if you were to brush your tongue, how would you do it?
So when I do it, just
Awesome.
straight down.
Perfect. Great. So far you're in like a good position. I love it. What I do want to show you now is how you should correctly brush your teeth.
Okay.
What you're doing is like a phones method. It's more so for kids.
Okay.
I want you to do something called Bass method. It's a Bass brushing method. You could always Google it. Also, Stillman's brushing method is awesome. It's at a 45-degree angle to the apex of the tooth and the gingival sulcus. So you're gonna do that. You're gonna brush and sweep down. 45 degrees, brush, sweep down. Okay. And you're doing this. This is occlusal brushing. I love that. Perfect. Okay. Gets those pits and fissures. Awesome. You were doing this. We're supposed to do this. Brush up, brush up, brush up. Get that mirror dirty. Have a heyday. Make sure you sweep up. Same with the top, okay? Brush up, brush up, brush up.
Okay.
All right? And we do want to use a soft bristled toothbrush, not medium, not hard. It can actually, and you don't want to scrub brush really hard. It's like abrasion. It causes recession of your gums, and it's never reversible.
Okay.
So we want to be very careful with that.
Okay.
Flossing, what we want to do is take at least 18 inches of floss, and we wrap it around our middle finger,
Okay.
and we're going to go down, make a C shape, hug the tooth. A lot of patients will just use the same piece of floss too, which is not good. So they'll just use the same piece of floss. Say for instance that you have a sick pocket in your gums, right? On one area, and you floss, and then you take the same floss and transfer it to the other tooth. That's actually transferring that bacteria, and it's no good.
Wow.
So we're going to do this. We're going to go down, jiggle in there, C shape, hug that tooth, up. Jiggle in there, C shape, up. And then you move a little bit of space, and then do it so on forth.
Okay.
Okay? And the tongue brushing, you did it perfect. Like that. Down, 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 down.
Okay.
So that bacteria gets off your mouth, off your tongue. So the flossing interproximally really helps, and same with the brushing the teeth in the correct area with the tongue brushing, because if you don't get the correct areas, that bacteria biofilm will persist in your mouth, and it will just bake in there basically.
Wow.
And it loves that, but it's no good for you.
Okay.
And you want to get rid of that.
Of course.
I also recommend this Dentitech. It's an interproximal device. It has a little bristles. It's super awesome. Then also these interdental cleaners. They have little bristles, very soft. So what it does, you just go interproximally, in and out, in and out. And that breaks up the bacteria, so it's not
Stuck like
stuck in there. Yes. Yep.
That's cool.
So it's very important to take away that biofilm and that plaque buildup.
Yeah.
What kind of dentifrice are you using at home?
What's dentifrice?
Dentifrice is a type of toothpaste.
I use a Colgate, no, Crest 3D White.
Okay, 3D whitening. Okay, so 3D whitening is good. If you want a nice white smile, it has a sodium bicarbonate in it that creates the white appearance to you. It is a whitening agent. That's fine. It does cause sensitivity, so I would be very careful on that. Something that I recommend is Pronamel Sensodyne Mineral Boost toothpaste. I don't have it on me, but this is what it looks like.
Oh wow, okay.
Its active #1 ingredient is sodium fluoride, and it's very important for you because it remineralizes your teeth, it makes your teeth stronger, it prevents from cavities. It's awesome.
Okay.
And it also has a nice minty fresh aftertaste, so it's like, it just makes you feel so clean. I love it. I highly recommend it.
Definitely go for that.
Yes. Mouthwashes, you said you don't really use them.
No.
But I do recommend like grabbing a Listerine. It has that alcohol. It's an antimicrobial, so it takes that bacteria buildup away.
Okay.
Okay. Same with something called chlorhexidine. We could have the dentist prescribe you if you like. It's the most sustainable mouthwash. It's awesome. It takes away that bacteria buildup as well. Keeps your mouth very healthy.
Okay.
So now that we went over all of that, oh, you can also buy that in stores, no problem.
All right.
So now that we went over everything, I just want to see if you got a good grasp on everything that I have taught you today with the brushing, the flossing. I do recommend you pick up this toothpaste, and next time I do see you in 6 months, I want to see how that's working for you. All right, so please show me how you brush. You're going to change your toothbrush, by the way, every 3 months. Did you know that?
No. So every 3 months.
All right, awesome. But now you know. Soft bristles, okay?
Okay.
You don't want to create any type of abrasion or any type of recession to your gums.
Okay.
Okay? All right, show me.
How we did today.
Yep. This is how I want you to do it at home, so for now on.
And like that.
Nice. Beautiful.
And then
Great.
for the top of my teeth, the bottom here.
The interiors.
Interiors.
That's where my concern is.
Oh yeah.
Perfect. Perfect.
Out of it. And then the
Awesome.
top is the same way, basically just going down.
Great.
All right.
And you're going to typically do this for 2 minutes all around, everywhere, okay?
Okay.
And you were doing that occlusal brushing, like on the flat surface of your teeth. I love that.
Okay, so continue doing that.
And definitely reach all the way in the back of those molars, okay? Flossing. Oh, show me how you would do the tongue brushing. I really want you to do that.
Oh.
Awesome. So you want
Straight
that
down.
tongue as clean as possible.
And
Take
take
all
the
that
bacteria
nasty
off.
bacteria off.
Okay.
Here is our floss.
So
Floss away, my friend.
middle finger right in,
Awesome.
roll it in, and
Such
then
a fast learner.
how?
We're gonna actually put it, all right, yep,
Tighter?
yes.
Okay.
And then down, C shape, up. C shape, up. And you're always gonna wanna switch it.
Always switch it. All right, so move it down a little bit.
Perfect, you're great. You seem like you are getting it. I love it.
Okay.
Some motivational techniques, let's see. What would motivate you to brush more often? What would motivate you to even floss more often?
Just like having a better smile, and just avoiding the dentist in general, not getting cavities or not having to come in for any fill-ins or anything like that.
Okay, that's good. And you want that beautiful smile. You want to obtain that.
course.
You have such a good smile. You have
Thank
great teeth.
Thank you.
Awesome, no problem. So definitely, yeah, flossing interproximally and
Okay.
getting those, in between those teeth,
Yeah.
getting that bacteria out and really brushing correctly with that 45-degree angle.
Yeah.
That's really going to keep you away from seeing a dentist, from getting a cavity, or, it's going to... Oral hygiene is the #1 thing to make sure. It's so important. It's such a very important thing to obtain. It'll keep you out of the dental chair, but only in my chair. So that was my OHI video. My patient is awesome, and I hope you enjoyed.